So S-Rom is the stem that is the most preferred stem for dysplasia basically, or proximal femoral deformities, or where there is a there is a mismatch between the proximal femur and the distal femur. So the S-Rom comes into so the proximal part, there is a sleeve, right, and this is the stem. So you need to prepare for the sleeve and the stem goes in the sleeve. So there are two different preparations, right? So that is why it is a modular thing. It is not stuck. So now how do you, so it is, it looks quite complicated, but it is not. Believe me, it's very simple, it's not that complicated, right? And the terminology, the stem comes, the smaller stems are 6, 7, 8, so they are basically the stems. Then you have 9, 10, 11, 12. And then the lengths are also different, right? You also have longer stems, right? And this offset is also, it has a 30, 36, 3 types of offset. Then there is a lateralized offset also, and then there is a calcar building also. But I think the calcar replacement is not available in India, right? And this is a sleeve, this is a ZTT sleeve, right? So this sleeve mates to the stem. So every stem there is a particular sleeve, right? So it cannot be interchanged, okay? And the stems are like, so it is, the proximal part is 5 mm thicker than the distal part. So if it's a 9 mm stem, so the proximal will be 14 mm. So it is known by 9 into 14, okay, right? And this 14 mm and the sleeve is accordingly. So the inner circle is the 14, right? If it's, suppose it's a 9, so inner will be 14. Then you have 14 BDF, right? So BDF, so dikhana sleeves, dikhana. Show me BDF of anything, any.
So this is
B.
B is here and B is
So if you can see these 3 sleeves, right? So this is what, 16, yeah, 16. So 16 will go with the 11, right? So 5 proximal is 5 mm larger. So with the if you're using 11 stem, then you need a 16. Right, so it will be 16 BDF, right? And then if you see these 3, so it is the yeah. So yeah.
BDF and this is.
Okay, so if you see this cone, right? So this increases B, D is a little bigger 5 mm, and D is F is a little more larger, right? Then it has 3, these spouts are also different, right? Large, small, large and extra large. So these spouts. So the sleeve comes like, for every stem, suppose it's a 11 mm stem, so it will be a 16 BDF, small, large, extra large. So there will be 6 sleeves, right? 7 sleeves, right? So yeah. So you got it. So and this then will be mated to the stem, right? So you need to see how you select the sleeves, okay? So everybody got it. So the stem is referred by the distal diameter into the proximal diameter. The proximal diameter is 5 mm more than the distal diameter. So if it is a 9 mm stem, it will be 9 into 14, right? If it is a 11 mm stem, it will be 11 into 16. Then it is a 13 into 18, okay? And similarly, the sleeves will be referred correspondingly. For a 9 mm stem, it will be a 14 BDF, small, extra small, small, large. Small, large, extra large. So these 3 type of sleeves are there, and and you have so much modularity. The sleeve diameter increases, the spout size increases. So depending on where it is fitting in, you have to select the size of your sleeve which goes in with the stem. Okay. Okay, so now you do the cut. So the cut can be, you can do a normal cut also. It's not necessary to do for a S-Rom, because the sleeve sits like that. So ideally you should have a a horizontal cut here, right? But even if you do a normal cut, you can do a S-Rom. So it doesn't matter, right? So you can mark this. इसको उल्टा रखो ना, ये एंटीरियर अप्रोच हो गया, उल्टा करो, या सो So they want me to do by a direct anterior approach. Huh? Okay. So here you go. So you can put the template, and these all things you have to decide, you know, if preoperatively where your neck cut is going to be everything. Once you know that, then you can, you know, mark your neck cut like this. So it's a horizontal cut. If it's a primary case, in revision case, the neck is already cut there. So, you know, so you do, so you can, normally you can take out this bone is so next you have to open the canal. Your box cut is there. So it has, so you know, it has a circular, you know, box chisel, right? So you open the canal. Canal है इसमें? Bones don't have a canal, so you know, it's just more for a demonstration thing. Be careful. So now, and the other thing is, this is called a Christmas tree reamer. So this is very good to open the canal. Okay. Then you start, once you open the canal, I hope it's open, right? So then you start your distal reaming, so as to, show me the stem, so as to ream for this, okay? So you can decide preoperatively, or they have templates, so what size stem you are going to use. Otherwise you can have a feel that, you know, so this is what? 8. So you can 9 नहीं है, 9 दोनों. So this is 10. So I think, so the thing to ream, so there is, when you are reaming, suppose you want to put an 11 stem, it's better to ream 11.5, right? So that's the recommendation to ream. कितना है? 11.5. So this looks all right, right? So 11.5 will ream, right? And this reaming, इसको लगाना है. The depth of the reaming is decided by the size of the stem. The standard stem कितना होता है? 180, 160. Yeah. So you ream till this point here, right? And then take it out. So now you have ream for the stem. Stem दिखाओ. Yeah. So you have ream for this part, right? Now you need to ream for this. Okay. So this is 5 mm more than this. So if you are using 11, so this will be 16, right? So then, yeah. So then you have these 3 reamers depending. So you start, the 16 has 16B, D, F, right? Depending on the sleeve, right? So you start with the smallest one. So, you know, 16B, and there is always a pilot shaft. And unlike the, you know, this is a good pilot shaft, unlike the one with the their sleeves here, or the stems here, it is a screw in, so it never stays inside, right? And you know, if you see this, it also has markings here for 30, 36, 42. So where it is on the greater trochanter will give you an idea the neck length that you are going to use. Okay. So you put this in and you ream. So this is 30. Okay, so it's fine. So now you have ream for this part. Okay. So your stem should go in, means you don't put it. So you have ream for the stem. Now you want to ream for the, you want to, and also you have, suppose now depending, so this was what, 16B. Yeah, suppose when I put it and it was loose, so I can go in for the next reamer, the conical reamer, that is 16D, that is for the D sleeve, right. So this reaming is done for the sleeve and the proximal part, right. And if this is loose, then you can go for 16F, which is a little more thicker. Okay. So next you go for the, now you need to make space for your spout, right, this part. So you need to, because here, so this part can be put where the best bone is, right. It need not be only at this place, it can be here, it can even be on the trochanter, because the ability of S-Rom stem is you can put it, इसके साथ का देना stem, ट्रायल नहीं है, नहीं इसका कौन सा है, इसका दे दो ना जो है, ये इसका है ना. So with the original implant you can put it anywhere independent. So it has 360-degree rotation. So the sleeve goes in the best bone and the implant goes according to your inversion, right. So you can put your sleeve like this, like this, like this, okay, anywhere. So next thing that you do is you make space for the cone, the spout. So you have this conical, the reamer for this. So this again, whenever you are doing this reamer, you always have to attach this pilot shaft, okay. And then this has a reamer which will ream for it. So here also, you know, it has, so this assembly also comes differently for B, D, F. This assembly is different, right, because D का थोड़ा मोटा होगा, F का उससे मोटा होगा, so you have to understand. So these three assemblies are different. So once you have decided, suppose in this we have decided D, so for D we are using a D. Suppose we had done a conical reaming for F, then we need to use to this F. So you have these different adapters for the conical reamer, right? For the, you know, reamer for the spout. So you put this thing in this. Okay, then again here if you can see, it tells you the various neck lengths, right, 30, 36, 40, so it should be till here, and it also tells you an approximation of the sleeve size, extra large, large, small, which you want to use. The neck length is the initial reamer when we put. So if it's a CDH or DDH, we usually use a 30 size neck length, right. So here if you see, then it goes in here. So there is a slot here. And so one person has to drill. The other person has to slowly tap this in, right. So you keep on tapping, and you have these neck lengths here, 30, 36, 40. So this 30, if it comes to the greater trochanter, so approximately you will be fine with the 30 neck length. Okay. So if you see, we have made space for the sleeve, right. So this is the sleeve, space for the sleeve. So this space can be made anywhere. The important thing is that wherever the best bone is. So you can make it here, you can even make it on the trochanter side, right. Okay. So basically now your stem preparation is done, right. So now you put in the trial sleeve. Okay. So how do you put the trial sleeve again? So show me. So always this pilot is the most important thing, and they only have one for each stem. So if वो गिर जाता है तो बहुत problem है. So this is, and if you see that, मेरे को दोबारा से दिखाओ. If you had seen, I will show you again. इसमें लगाओ वो pilot shaft. Suppose yeah. So when I was doing this, so and So if you see this mark here, यहाँ पर, so it has come to small, okay? ये small है, ये हाँ large है, ठीक है? So this will also give you an indication of what sleeve size or spout size is appropriate, okay? Small. So since this being a saw bone, I will use a small. So you put in the sleeve. So this is the impactor for the sleeve, trial sleeve, okay. So this goes in this, you attach the pilot shaft here. And you put it in the place which has been prepared. And you bang it in, right, and it has already fractured. Because this is saw bone, okay. So the sleeve is there, already positioned. Now you need to put in the trial stem. So the trial stem can be assembled outside. So this is the pilot, then you have this, निकाल के दिखा दो. This is a 30 neck, so they have a 30 or 36, ये क्या है? 36. हाँ, so this is a 30 neck, so you know, so you have to put this in, screw it in this, and then again you need to know this, that you know how do you adjust for your anteversion. कहाँ है इसमें line को लगाओ?
This is the line.
हाँ इधर है ना, लगाओ इधर line पे.
Line. Light.
So if you see this, there is a line there. So if it matches with this, so when you are doing the trialing, this is important to see what anteversion, because it locks in. It locks in like this, in this, okay. So you can move it to any anteversion, okay. But how do you move it? You have to align this line with this. If you align it with, उसमें लगाना line करके. So if it is aligned with this line, okay, so it will go like a normal stem. But if you want to increase the anteversion, इसको खोलो and you increase the anteversion or decrease the anteversion, so it will increase or decrease, okay. This is for the trial, but the real you can, because the real doesn't have slots like this, so it goes in like that, you can dial it in whatever anteversion, okay. इसमें लगाना उस line पे. Okay, so you just put it in this and so you can change. इसको बाहर निकाल के करना होता है वैसे, ठीक है ना, छोड़ दो. So mallet,
वो दे रहा हूँ, इम्पैक्टर दे रहा हूँ.
तो रियल का इम्पैक्ट है वैसे, इसमें नहीं लगेगा यार, ठीक है. So in the real stem, when you put it with this. So there is a slot where stem. इसको ट्रायल को ही करता हूँ. ट्रायल को इम्पैक्ट करने के लिए you can do anything and just put it in, right? So this is your stem which has been done. Okay, so it's very simple. So you just need to, you know, go through the instrumentation once or twice. You will understand it, right? So you need. With subtrochanteric osteotomy, what you do is you prepare for the sleeve, you do the osteotomy, right? Then you see, remove the bone, and then you put in the stem. But again, in subtrochanteric osteotomy, you have to remember that when you are preparing for your distal part, suppose you know, कितना था ये दिखाओ. So you have to ream extra 10 mm or so, because this bone will be removed, the stem will go in more. Okay. So this is the important thing for subtrochanteric osteotomy. Okay. Yeah, and this is the remover for the, you know, stem. And the beautiful part of this is, show me the real one. The S-Rom doesn't osteointegrate the whole stem. It gives fixation by these splines here. The only part which osteointegrates is the sleeve. right? So what happens is, मान लो ये है, आपने लगाया, patient dislocate कर गया, has a spinopelvic problem or anything, you want to change the anteversion, you can go in again, take out the stem, put it in some other anteversion. So that is, so the only part that osseointegrates is this, and believe me, to remove this sleeve is very difficult. You know, 1 or 2 infected case we have done, it takes out all the bone, it's very, very well osseointegrated, this sleeve, okay? Okay, and this is the one to remove the trial sleeve. You have this instrument which catches on this. Okay, any questions for S-Rom? So 16 BD, these are all for the sleeve. Okay, वो दिखाओ एक बार, I'll show you. No, this is this diameter. तो B छोटा होता है, D उससे बड़ा होता है, अंदर का डायमीटर सेम है 16, ये ऊपर का बढ़ जाता है, समझ रहे हैं? और F इससे बड़ा है, the size ये.
But the dia is 16 in everyone.
This is 16 is only for this, for the stem, but bone तो है ना यहाँ और. Okay, तो वो मोटा होता जाता है, ऐसे ही ये बढ़ता जाता है स्मॉल, लार्ज और एक्स्ट्रा लार्ज में, ठीक है? नहीं, इम्प्लांट में वर्जन चेंज कर सकते हैं किधर भी. इम्प्लांट यू कैन चेंज, इम्प्लांट इज दिस ओनली, यू कैन चेंज वर्जन एनीवेयर. हाँ, you can change. So when you are putting in the implant, you put in the sleeve, then you put in whatever version is there, and then you have markings here. You see, you have markings here which guide you, right? So you can even do, you can put in the trial sleeve, you can put in the trial implant, see where it corresponds to your version, and then put in the real stem there. Okay, and there is a line here which also helps you, you know, align it intraoperatively, ताकि आपको पता हो किधर डाल जा रहा है, right? Okay, so now any other question? So now we will have, I think they have another stem for revision specifically, which is known as the reclaim stem. It is a modular stem in which you have a proximal part and a distal part. You will not. If there is a, you know, if there is no metaphysis proximally, so you can't use. So, you know, you need to have that, you need to have a space for the sleeve to be put. Right.
After doing S-Rom osteotomy, we find distraction, then how to address it?
You need to take out the stem, right? You have to ream extra distally. It is distraction is occurring mostly because you have not reamed 10 mm distal, or you have not reamed more distal.
It's a very, very common fault.
Yeah. So you have to ream. See, you are removing in between around 1 centimeter of bone, 2 centimeter of bone, right? जब वो निकाल के पास आ जाता है, आपने रीम तो उससे कम किया है ना जब ओरिजिनली किया है, तो आपको डिस्टल रीम ज़्यादा करना होता है पहले ही.
और अगर बोन कर्व्ड है ज़्यादा तब
वो लॉन्ग स्टेम्स होता है, they have curved stems ना, curved stems हैं तुम्हारे, they have S-Rom long stems are curved stems, right?
Thank you.
You, if you are not confident about the fixation, about the stability with the stem, then you have to, you should fix it. The other thing is that the real stem has more splines. It has 8 splines as compared to the trial. Trial only has 4 splines. So you know, so you get extra stability when you're putting the. So the other stem is the reclaim stem, right? Reclaim is basically a modular stem. So it has a distal part and a proximal part. It comes in various sizes. It starts from 14 से है ना? 14, and it has a length 140, 190, 240 and 290, and then there is a proximal body which is around 65, 75, 85, 95, no? So you have these different bodies, so you have to prepare first for the distal part, then you have to prepare for the proximal part, okay? So the first reaming that you do is you find the canal. So this is the canal finder reamer, so you find the canals, and here if you see it has marks, right? So it has marks of 75, 85, 95, 105. So you know, when you are putting in this, suppose it stops at 75, so that is, you know, so the proximal part will be 75. So you normally prepare for 85 so that you have the ability to, you know, go down one size and go up also, right? So, and you can mark it on the trochanter here, so, right? So then you can correspond it to that, okay? So you first, इसमें तो हमने canal खोल दी थी S-Rom reamer से, ठीक है? So you open the canal with this, Then you have this instrument, this is so as to clear the bone initially, and it also has a mark. This instrument, I'll tell you why it is. इसको करना. ये टूट जाएगा भी नीचे से, बट ठीक है. सो ये पूरा वो करना होता है. दिस इज बिकॉज द नेक्स्ट रीमर गोज ऑन टू दिस, एंड इफ यू सी दिस इंस्ट्रूमेंट, it is broader here. So to make space for this, you need to this is a clearance reamer, you have to ream with this. Okay, and there are marks here again, so they must go to the corresponding mark here. Okay, then you ream distally depending on the size. ये क्या size है? 14 है, वही दे दो. अब एक पेरीप्रोस्थेटिक फ्रैक्चर होने वाला है. 14 होगा भी नहीं कैनाल इसमें ना. सो ओके, इसको निकाल दो यार, हाथ से निकाल दो. नहीं, बाहर निकालना है. ओके, ठीक है, कोई बात नहीं. So now you have prepared for the distal part. Now you need to put the distal stem, distal part of the stem, which is an implant, and which unfortunately they don't have it. They don't want to open it. Okay, so we'll use the. So the beauty of this is again is that you can do the trial on the reamer. That's another good advantage of this. So you can put in the reamer and you can do your trial, right? Reamer पे लगा के दो trial. नहीं, reamer ये तो चला जाएगा ना. हाँ, ठीक है. So you can put this in. इसको निकाल दो. ठीक है. Okay. And so these are the. क्या है, कौन सी है? Okay. So now, so now you need to ream for the proximal part. So this normally you should do it on the real stem. So once you know your real stem, you put the real stem, then you put this and ream on it. Okay, for the proximal part. And these are the reamers for the proximal part. So they are 20, 24 and 20. 20 and 24. और एक और भी होता है ऐसे 28. 20, and the difference between this 20 and 24 is the offset. The offset of 20 is smaller as compared to offset of 24, though, right? Of the proximal body. Then you ream over it, make space for the proximal part. Mostly, many situations ETO will be done, there will be no bone in revision, so you don't need it, but you need to do it so as to make space. रिवर्स चल रहा है. So it is done. So now you have made space for the proximal body. इसको निकाल लो. अंदर चला गया वो. So you screw this in और इसके ऊपर then this is the next. So ये दो में आता है ना, 40 and 45. So then you put this over the So this is done. Okay. So जो real होता है, real में ये होता है कि you have the distal stem which goes in, then you do the proximal reaming over it, and you have proximal body. The proximal body has 4 lengths. ये वाली होती हैं ये 75, 85, 95, 105, and उसके साथ neck उसी में आता है. Neck is with the proximal body also. है ना. So that is one proximal body with the neck, and these are two ties 40 and 45. Okay. You remove ream distally, put in the stem whatever size is coming, ream for the proximal body, put in the proximal body, and that is all. And you can, you know, this is you can rotate it anywhere, the version, right, and fix it. Okay. Now there are 2 or 3 things with this stem that you need to be careful that, you know, while putting the proximal body to this, there is a screw which goes in, and that there is a screwdriver. There is a screwdriver which has a, you know, tensioner. Sorry. So it has to be tight. So to limit that torque, there is something which is, you know, you need to put this in, and you need to apply a lot of force, and there is a torque limiting there, right, for the final, the real implant. इसमें नहीं लगेगा, वो real stem पे लगता है, and then इसमें you have to, you know, पूरा वो करना होता है.
Except for the dia, what is the difference between the proximal shaft and the distal one? It is porous or what is coated or something? What is the difference?
No, it is based. It's sort of a model of Wagner. Okay, so distal is coated. It's a titanium stem, right? It's just like a Wagner, but the only thing is that it is modular, right? It is a 2.5 taper as compared to Wagner, which has a 2 taper, right?
What is the advantage of this over Wagner?
Wagner is a monoblock stem. This is a modular stem, so that is the advantage. So, you know, so type 3 or type 4 defects, you can use this, right? So, you know, it gives you modularity as compared to Wagner. That's the only, if you ask me, that is the only advantage, right? I think they are also having, they are launching a reclaimed monoblock also, right? It's all titanium, porous coated. Yeah. It's a tight, yeah, it's a fluted stem, the distal part. Yeah. The whole. Proximally, usually there is no bone innervation. So main it relies on the distal fixation. Yeah. So the concept is, you know, distally, you put it distally, then you can build on the proximal length, right? So you have 4 different bodies. So you can build the length on that. So once you have achieved fixation, this is a distal fixation stem, right? Okay.